My name is Donna Jordan, and I'm a patient of Dr. Ghaly's for about a year and a half. I came to Dr. Ghaly because my body had completely shut down. I've been suffering with lupus for approximately 20 years. I was diagnosed in 1998, and I've been sort of through the gamut of remedies, treatments, medicines, everything you can possibly think of to try to get some sort of relief from this condition that they say there is no cure for, only treatments. So I was really sort of divinely led to Dr. Ghaly in the first place by a friend of mine all the way across the country. However, we managed to hook up and divinely I met him. When he saw me, he was very concerned that as a 60-year-old woman that I had deteriorated or my body was not acting the way it should for my age, you know. So he said, I think I can, he said, as a matter of fact, he said he knew he could help me. He suggested a program of stem cell therapy along with vitamins and a few other magic things that he had that worked for me. And we started this journey last year, September, and now I'm starting to truly feel the benefits of all of his treatments. I have to say, probably 6 months after the treatments, it was a miraculous difference. It was a complete change to the way I walked, the way I talked, how I felt, my spirit. I was more attentive. The fog that you usually get with lupus was dissipating. So it was an experience that I'm still going through, because with trying to manage this condition, it takes quite a few treatments. It takes, you know, different things and different combinations of things. And the reason Dr. Ghaly was so different than any of the other doctors is because he has a special gift for diagnostics. He can look at you, he can get certain tests, he can see, he can touch your skin, he can feel you, he can see the way you talk, the way you look, and he's able to tell you exactly where your deficiencies are and what you need in order to make yourself be the best you can be. So it's an ongoing process because you're constantly learning different things, and every body is different, everybody's body chemistry, their DNA, and he recognizes that. So he treats each one and he gives each one their own special formula that's going to help them progress. So, you know, there's no comparing this person to that person with this treatment, that treatment. Everybody is different, and he has that gift to look at you and be able to take the testing that he does and put together a program and a formula that's going to help you be, you know, at your optimal ability, your optimum health, I guess that's what I'm trying to say. But I just want to say that I am really grateful for meeting him, and that, you know, the universe sort of kind of guided me towards his way, and we'll see how it goes from here. I have, you know, received, as I said, a lot of help, and I'm still on this journey, and I'm going to go and keep on this journey with Dr. Ghaly.
So Donna, yeah. I have been seeing you for a few years now, right?
Correct.
Yeah. So when you first came to see me, you had issues, you had problems. Why did you come to see me then?
I came to see you initially because I was just worn down after struggling and trying to manage my lupus condition for so many years. I had tired of all of the different remedies and treatments and medicines that, you know, I didn't want a Band-Aid, I wanted a cure, I wanted a fix, something more long-term. So I was referred to you 3,000 miles away, you know, through a friend, which sort of, I kind of go on instinct and feelings and impressions, and I got impressed that I needed to make that trip out here to see you, because you, my friend told me that you had a gift, a special gift of diagnostics, that you could look at a person's eyes, you could look at a person's skin, you can touch them and feel them, which, by the way, a lot of doctors don't do these days, but you were able to diagnose exactly what was wrong with me and give me a more accurate treatment program that other doctors did not give me. And, that's what led me to you.
You know, whatever you said touched my heart. And I thank you for that. I always have a relation with my patients, and
Sure.
I feel there is a thread between us.
Definite thread between us.
Yeah.
And it's a thread that we might not have, might have gotten together, but we got that thread through that needle of that eye, which is very, very difficult.
Yeah.
And
You came 3,000
miles for that,
Wow.
and that's nothing when you can find someone who can. I would have traveled 20,000 miles if I could have found someone who could diagnose and give me some sort of relief from the.
So you've been ill for how long?
I've been ill since 1997 that
Wow.
I could put my finger on, and some days worse than others, but I've been through a lot of trauma. My family has been through a lot of trauma. It's when you have illnesses like this, people don't always realize. I'm sorry.
It's okay. You have clinic.
People don't really realize that it's not just you that are affected. Your family members, your husband, your children,
Yeah, of course.
everybody who you're in contact, your friends. Nobody wants to see you suffer.
No.
And because no one knows how to help you.
No.
They want to help you, but they don't know how to.
Right.
So it's a difficult sort of situation living through that for so many years, which is why you also have to be careful, because as a patient, there's a lot of snake oil salesmen out there, and you have to be careful. And sometimes people will take advantage of your desperation.
Mm-hmm. You have clinics.
And I didn't feel that with you.
Good.
I felt that your sincerity and your and honestly, the modesty of your office when I first came also impressed me. It was that you weren't into the fanfare or the fuhu-shishi, as they would say. It was all about the medicine. It was all about the work. It was all about helping people. Your desire to help people. And I believe that it wasn't for greed. It wasn't for other sort of things that a lot of doctors in the medical industry sort of gets into. I could feel your heart. I could feel your impression. And I knew that you just wanted to help people, especially with these kind of conditions that people have no idea how to cure. There's no cure for lupus. There is only treatments. But you have a way or a technique, and this line of study that you're doing is in the path of getting lupus patients relief.
Lupus patients.
Lupus patients relief. And it's a very difficult thing to do.
Yeah, lupus is a very difficult disease and has many ramifications, affects many systems of the body, not only one system.
Exactly.
And you lived with that disease for some time.
Mm-hmm.
And shortly, how long before you start to feel some improvement? After the first visit?
After the first visit, I want to say probably about 7 to 8 months. 7 to 8 months.
You definitely saw improvement.
I saw improvement. It's more of a thing where I had more good days, because with lupus you do have good days and you have bad days. So I was seeing more good days than I had seen before, which was very, very, very impressive for me.
Did I introduce the idea of using your own stem cells?
You did.
To help you.
Yes.
Yeah.
Because also with lupus, I think we were also being a little bit conservative with our treatments, because with lupus sometimes you reject, other like umbilical, you might reject those, but I thought it was kind of a brilliant idea for you to suggest me using my own to reduce that possibility. Some people might say, but you already have something, so why would you use your own fat? But I think my fat was okay. I think it wasn't affected by the lupus. So we did what you call adult autologous stem cells, and
stem from your own
Yes.
adipose tissue or fat,
Yes.
isolated stem cells from that, and injected you intravenously, correct?
Correct.
And different parts of your body.
Right.
Yeah.
Right. Because I was having a problem with my knee and my hip, my shoulder, and it was definitely an aid in those positions. You know, of course, it's going to take time for my cells to adapt and to grab onto to the stem cells, but I do see that down the road.
So your lifestyle now have improved.
My lifestyle has improved. I truly was a recluse when I came here. Did not go anywhere. Didn't even go shopping. And I love to go shopping, even if it's just the grocery store.
Yeah.
But just the ability to walk up and down aisles, people take for granted some of the little things that when you have a chronic illness like this robs from you. But I couldn't do anything. I couldn't go to the movies. I couldn't go out to dinner. Just everything was catered to me at home. We'll bring it in. We'll bring it in. So life was
bland,
really bland.
Bland and totally meaningless.
Yes.
We're able to change that.
Definitely.
Yeah.
Definitely.
You're full of life, and I love that.
I feel it. And I'm doing more. I'm going out more. My life is starting to get more demanding. Physically demanding for me, so this is why I'm really kind of inspired.
And you're coping with the demands, correct?
Exactly,
Yeah.
exactly. And I hope to do better as I go on.
That's great.
Mm-hmm.
It's a beautiful story. And were we able to reduce your medication that were you taking for lupus?
Yes, quite a bit. And I was always stuck at a certain amount of steroids or prednisone. I could never quite get past it. I would go right into a flare as soon as I got down to a certain amount, but I've since then been able to reduce it much further than I ever had before.
That's great.
Right, and I look forward to not using it at all. So
eliminating it.
Exactly.
That's great.
Yeah.
So I'm really pleased. You have lost weight. You're full of life. In fact,
and that's always a good thing.
Yeah, and of course, I always used to tease your husband. I said, I'm going to take Donna for to go dancing with you.
Exactly. And I'm truly
and I'm waiting for that day.
Exactly. I am waiting for that day as well because I love to dance.
Oh, God, yes. That's good.
Yes.
Yeah, so do I. Yeah. Well, Donna, thank you very much for coming here.
Oh, it's my pleasure.
It's a
and
pleasure
thank you for being here.
Yeah.
Thank you for being. Thank you. I mean, I don't want to get too religious or anything, but I do thank your energy and your spirit. I thank God for letting our paths walk together at this particular time. Because I could have been somewhere else, you could have been somewhere else, but I'm grateful for this.
That touches my heart.
Okay.
Donna, thank you very much.
You're welcome.
Right.
Thank
You're
you.
lovely. Yeah.
Okay.
And we'll continue on moving forward and improving your health and condition.
Oh, forever. Exactly.
Thank you.
Thank you.
Okay, Donna.
All right.